Have I seen people in whom I have injected too much fat and had to remove it? No. Question was asked, what can you do if too much fat is injected during a fat transfer? Well, that is a really, really interesting question. Um, Let me go back a little bit to the history of fat transfers. What you should know is in most areas of the face, 50% or less of what is injected, what fat, your fat is injected, will stay permanently. So sometimes it may seem like a little too much fat was injected into various areas, and almost always that will dissipate over the period of the next couple of months. Now, having said that, does that mean you're going to look grotesque between when the fat was injected and when 50% of it's reabsorbed? Not if it's done properly. For example, my philosophy is I want to push the envelope far enough so you look really great when you have the fat transfer, but not silly in any way. There are people a decade or so ago who were doing fat transfers who were overdoing them with the idea that, well, in a year, you're going to look a lot better. Well, that's insane. I mean, you want to look better immediately after the fat transfer, and then a percentage of it will go away, and you'll augment that percentage a second time. And we know just a few months after the fat transfer how much is going to stay and how much is going to be reabsorbed, and whether or not you'll need another session. Most people need 2 sessions of fat transfer to get a really good 50 to 75% correction in the area. Have I seen people in whom I have injected too much fat and had to remove it? No.